Hi, I'm Josh Levin and President of LympheDIVAs. I want to thank you for taking the time to watch our presentation, and I hope that when we're finished, you are able to walk away with some valuable information about lymphedema, what it is, how to manage it, and perhaps most importantly, what your options are. Because options is what we're really about. When my sister Rachel created LympheDIVAs back in 2006, it was because she had no options and she wanted to create choices for those dealing with lymphedema. But we'll get more on that later. For right now, let's start with the basics, the lymphatic system. Now, the lymphatic system is part of the body's vascular system. You know, your veins, your arteries, but they're different. The lymphatic doesn't have those clear pathways that we can see and that we know, like the veins and the arteries. Instead, it uses nodes and capillaries to process and move that fluid along. And then what happens once you start to damage that system, either through radiation or removal of nodes, you end up with a system that doesn't work as well. If you think about it like a pipe, the lymphatics are like a pipe in your house. Once that pipe starts to get clogged or has cracks in it, that pipe isn't moving fluid as well as it used to. It's either getting stuck or it's dripping out, but it's building up and not going where it's supposed to go. And that's what lymphedema is. The pipe isn't working as well, and the fluid is remaining in your limbs or your chest and not getting processed by the system, and it's creating that swelling. But the next question is, will lymphedema happen to you? And I'm guessing if you're here, it either has or you think that it may. Now, when you start looking at understanding your own risk for lymphedema, either before, during, or after treatment, it's important to know where you start, what may impact your risk, and identifying as early as possible what things are happening that may be getting worse or even getting better. So the first thing that you need to do is to take a baseline measurement. In a perfect world, this happens before any lymph node dissections, before any radiation, really before anything else has happened, so they know what that limb looks like before the system may be damaged. You can do this with a measuring tape, and that can be done preferably not by yourself, but you could if you need to. The best case is you have either a doctor or a therapist do it, but really anybody with a measuring tape and a pair of hands can at least get you some baseline understanding. And that's a very basic way of doing it. But there are much more specific measurements that can be taken. One of the newest ones that has been getting a lot of interest and approval is the LDEX machine, which sends a little current through your limb and it measures how fast it takes to get there. And then later on, they're able to take other measurements and see if it's moving slower. If it's moving slower, that's a sign that you could start getting the early stages of lymphedema. And it's a little bit more exact than the measurements, which could change based on time of day, who's measuring it. There are a lot of variables there, and this just removes a lot of those variables. Now, the next important thing is starting to begin to understand what your risks may be. And unfortunately, there is no list of risks that you can find that will absolutely apply to you. There is just too much unknown. And it's based on our lack of understanding of the lymphatic system in general, something that LE&RN is trying to help change, as well as a lot of the research that's been out there hasn't always been at the top. So there leaves a lot of questions as to what may or may not impact your particular case. So instead of saying this is what it is and this is what it isn't, we like to approach it more in a means of this is what may affect you. And it's a good idea to have an understanding of that you can then discuss with your doctors, your therapists, and yourself to decide what is my risk, what does it mean to make that risk less, and am I willing to do that? And any answer that you really come up with is an acceptable answer. One of the most important things that you should be aware of is infection and burns. Mainly because untreated infection or a burn can lead to cellulitis. And cellulitis is really one of the biggest impactors of lymphedema that's out there, and doing everything that you can to minimize the risk of cellulitis leading to lymphedema is something that you really should be trying to get ahead of. And so when you get a cut or a burn, you really want to either avoid that happening at all, of course, or to try and preemptively treat once that cut has happened. Now, because we are talking about an open wound if it's a cut, a needle stick or an IV does fall into that category. There has been a recent study that had come out that was really quite a good study, but it had minimized the risk of needle sticks and IVs, but it still mentioned the high risk regarding cellulitis. And because that wound could lead to cellulitis, there is still a risk there. And this is something that you should absolutely talk with your physician or your therapist about, and whether or not asking a nurse or anyone else who might be drawing blood or putting a needle in, whether or not you want to use your at-risk or affected arm or a different limb. The next up is really trying to stay away from wearing constrictive clothing, or really anything that could reduce circulation to your arm. Things like heavy briefcases and purses, anything that's going to cut off that flow that normally is trying to get past and is already not working as well as it should be. In addition, you want to try and keep that arm cool. A cooler arm means less capillary flow, and less capillary flow can lead to less swelling. So, keeping that arm cool isn't just a comfort aspect, there's a medical piece to it as well. And, doing so can have a big impact on your risk of lymphedema. And the next up is wearing compression garments during what are currently considered to be high-risk activities like air travel and exercise. If you look at the research, you are going to find studies that point one way or the other. But really what they say, along with a lot of the anecdotal evidence out there, is that wearing compression garments can make a positive impact during these activities with very little risk. But you should still absolutely discuss with your doctor, with your therapist, and if you are choosing to exercise, your trainer, what the best way to go about doing all of these activities would be. And finally, and almost one of the most important, is keeping a healthy diet. Obesity and lymphedema have a very clear correlation. And by eating well and staying in good shape, that is going to have an excellent impact upon your body in general and will continue to help you either minimize your risk of lymphedema or minimize any complications if you already do have it. So now that we've kind of covered the risks, the next question is, what do you do if you believe you have lymphedema? And what are your treatment options in that case? So if you don't yet have lymphedema, what you need to be looking out for is the obvious swelling of a limb, but things can start that you can pick up on before that even happens. And that's what happened with my sister Rachel. She felt a heaviness in her arm, and there was no visible swelling yet, but she did feel that something just didn't feel right. It felt heavy, it just didn't feel comfortable. And she talked about it with her doctor, who then pretty much looked into it further and was able to define that she did have lymphedema and give her her prescription for her first garment. So, if you do start either seeing a change or feeling something is wrong, talk with your doctor, talk with a lymphedema-trained physical or occupational therapist, and get their opinion, and then they will be able to lead you and educate you more about what you should be doing next. Now, when we talk about what about doing next, it really depends on the severity of your lymphedema. And this can range from anything like a very severe case that requires complete decongestive therapy with multiple layer short stretch bandage wrapping, to wearing over-the-counter compression garments either daily or just during high-risk activities. The difference between an over-the-counter garment and a multiple layer bandaging is very big. What we're talking about with multiple layer bandaging is the use of these short stretch bandages, which really don't move very much when your body moves. In addition, you've got multiple layers wrapped around your limb. So it basically kind of acts like a soft cast. And so when your body is moving and your limb is flexing, it's hitting a wall and you're getting a big spike of compression. And that spike of compression really acts like a pump and helps move that fluid out more than what it was doing before. With an off-the-shelf garment, and by off-the-shelf, I'm saying, it could be custom made, it could be something that you buy, in a box either from us or another manufacturer, but all of those garments, whether they are flat knit or circular knit, which is really just a manufacturing difference, both of those fabrics have a stretch to them, so that when you move and your arm flexes, the garment moves as well. And so that pumping action that you get with the multiple layer bandaging is very much limited with a off-the-shelf or custom made garment because of that fabric. Now, the way, besides the overall pumping action that these work, is they increase the compression inside and the pressure inside your limb. And the little one-way valves that the lymphatic nodes use to bring in, process, and move back out, they can work easier when they're under pressure. So it helps the system that is still working work a little bit better. And then these garments, if they are sized and made appropriately, are graduated, meaning that there is more compression further along your arm, and it should get lighter as you move up your arm towards your shoulder. That graduation means that things are moving from a high pressure environment to a low pressure environment, which physics tells us is a good thing, and the way things do like to move. And so it also helps that fluid move back to the core or back to a part of the lymphatic system that is working properly and can then process that fluid. Now, after talking about lymphedema, I want to talk a little bit more about LympheDIVAs and who we are, because we are very much a different type of company than what's out there. As I had mentioned in the beginning, we were started by my sister Rachel, along with another woman, Robin Miller, who both had lymphedema. This was back in 2006, when there really weren't any options available. It didn't matter what color skin you had, you got medical beige. The garments were typically in a fabric that was thick and heavy and coarse and hot and almost, most importantly, ugly. And it was something that they just didn't want to wear. And because there were no options available, they decided that they would be the ones that would make an option. And this was really the beginning of LympheDIVAs and the beginning of the innovation that we have brought to the medical compression garment industry. We were the first people to introduce colors and even an alternate skin tone. We were the first people to introduce patterns so that these not just look like a solid color stocking, but look like a fashion accessory. And we were the first people to really look at and understand that the hand garments that were out there were potentially causing a problem because the wrists on those hand pieces were highly compressive, and they doubled up the compression on top of the area of the wrist of the arm sleeve. And so when you want a situation where the most compression is at the furthest point, if you are overlaying a high degree of compression from a handpiece and from the wrist of the sleeve, you are potentially creating an area of even higher compression. And so we were the first to develop a hand garment that reduce that amount of compression and reduce that risk. And throughout the history of our company, we have always been the ones to push all of the others. For the past 10 years, we have been the smallest company making compression garments, but by far we have been the biggest leader and innovator. And we hope to continue all of that. We have addressed the issues of a hot arm by making our garments moisture-wicking and breathable. We have addressed the issue of comfort of these garments by making them lightweight. And we have introduced the issue of the style of these. And for people that don't want something that is going to stick out and look ugly, we make something that is beautiful and that you may actually want to wear and that you may feel good about wearing and not just good about managing your disease. As at the end of the day, our goal is to have a garment that works, is fitted for you by the amount of compression you actually receive within it rather than just what size you are. And by doing all of that, we hope that you are going to increase the odds that you'll actually wear it and that it's going to do something good for you. Now, before we go, I just wanted to go over again the issues of the importance of hand compression. When you're wearing just a sleeve, the problem with that is you now have the highest amount of compression of the garment sitting at your wrist. And fluid that used to be able to move from your wrist to your arm may be stopped by that. And so wearing compression on your hand, even if you don't yet have swelling in your hand, can help reduce the risk of swelling beginning because of that high level of compression at your wrist, and help manage it after that as well. But always, whether you're buying one of our garments or somebody else's, make sure that they are comfortable, that you are getting the right amount of compression, and that you are not getting that overlap, which may negate the whole purpose of wearing something on your hand. Thank you for your time, and I hope you all have a wonderful day.